Good afternoon. It is November 10th, 12:30-ish. I'd like to go ahead and call the special meeting of the Strategic Planning Board workshop to order for the Children's Trust. The mission of the Trust of Alachua County is to fund and support a coordinated system of community services that allows all youth and their families to thrive. Any member of the public wishing to be heard shall come forward to the podium at the appropriate time, introduce themselves to the board. Members of the public recognized by the chair will have 3 minutes to speak on a single subject matter or to address the current motion on the floor. So for the workshop, there won't be any motion. We're just gonna have a workshop. And the clerk of the trust will function as the official timekeeper. Please be reminded, our policy prohibits unplanned funding requests from the podium. Should a member of the public wish to make a funding request, please contact our executive director and staff for consideration. Now, the clerk will go ahead and call the roll to verify who is here for the workshop, and we'll get started. Madam Clerk, you're recognized.
Member Tina Certain. Member Mary Chance. Chair Ken Cornell. Dr. Nancy Hart, member. Dr. Maggie Labarda, treasurer.
Here.
Dr. Kamala Patton, member. Member Lee Pinkeson. Vice Chair Cheryl Twombly. Honorable Suzanne Wilson Bullard, member.
Got 6 here for the workshop, which is great. We may have member Chance joining us lately, and we'll certainly have I think Judge Bullard joining us, Honorable Bullard, for at least our meeting at 4. We'll now go ahead and move to the approval of the agenda. And a motion to approve the agenda. So really, the agenda is just, again, the workshop on our strategic plan. We will give the public an opportunity to speak prior to our public discussion. Seeing them back. All those in favor say aye.
Aye.
Any opposed? That is unanimous. Okay, so Marcia, why don't you frame our day? We've got plenty of time, and then what will you?
All right. Thank you, sir. Thank you, everybody. Good afternoon. We are here today to continue our strategic planning workshops as we look at the goals. Today, I believe that C. Robinson and Company will take us back to July, just as a reminder of what you all discussed, what we said we wanted to do. And then they're going to bring you forward and share with you the work that the staff has been doing since the July workshop, where we have looked at each of the goals. We have created some indicators for all of the focus areas, as well as, I'm missing something, the indicators and the, thank you, and the impact measures. And so today is your opportunity to hear those, give us some feedback, help us as we kind of begin to drill down into what the plan is going to look like. We understand that we still have a funding discussion. And so at the end of today's meeting, we want to discuss our planning for the funding discussion. So I think I have hit the highlights, yes. I'm going to turn it over to Conchita to get us started. And I want to say thank you to Conchita, to Regine, and to Jackie, because they have been doing a lot of work with us, with staff, with me in particular, going back and forth, making sure that they understand what we have been doing, what we're trying to do, and keeping us clear on what you said you wanted to see. So thank you all for holding us accountable to the board, helping us understand what you heard from the board when you had those interviews. And hopefully today, we will all leave here in one accord. So I'll turn it over to you all at this time.
Thank you so much, Ms. Kiner, and to the board. Chair and the board members and staff. Again, we appreciate the opportunity to work with you on this very important task of updating your strategic plan. We were together in July, and since July, a lot of great work has been done. My team will take you through the presentation, but I would tell you lots and lots of conversations, many work sessions, and there's been a lot of homework done by the staff before those meetings started and in between the meetings. And we are at a point now where we would like to just bring to you where we are at this point, knowing that we have until the spring with the budget to get everything approved, prior to your budget work to get everything approved. But we wanted to come back to you now, and I think, again, once, maybe twice more to get final approval. Jackie?
Good morning.
Jackie.
Remind me of the microphone. Not used to holding this. I think I talk loud enough so I feel like everybody could hear me. So when I leave it laying somewhere, just remind me.
Yeah, it's mostly not for the room, but for the folks at home and the recording. Yeah, thank you.
Oh, okay. Okay, great. There we go. All right. Thank you. I want to say thank you for having us back. It's been a few months, and as everyone has said, we have done a lot of work. Staff has done a lot of work. It's been great working with your staff to get us to this point. They are committed. They have been putting in the work, and I think you will see as we go through this what we have accomplished together. So today's agenda, we have had the welcome and purpose. You've heard from Ms. Connor and Ms. Robinson. We're going to talk a little bit about what has happened between July and October in review to give you a better idea of where we started and how we got to where we are today. We are going to look at some of the staff recommendations as it relates to the focus areas. The goals didn't change, as you remember, but we did add a goal. We added a fourth goal on capacity building. So we're going to really dive in on those focus areas, the indicators, and the impact measurements. Then, as Marcia said, we are really going to come back on the funding. That is going to require some in-depth work, and we really would like to get a little more direction from you today on that and how we go about working with the budget and the funding as it relates to our providers. We will give you an opportunity, any questions that we haven't answered through the process, to come back and do a little Q&A session, and then we'll wrap it up. So we appreciate you being here and sacrificing your time to go through this with us. So looking at June to July, just to bring you back to where we started, we conducted pre-work interviews in June and July with each of the board members to really get prepared and to get your input on what you'd like to see in revising this new strategic plan. We got a lot of information from you as we talked to you, and heard a lot of things about what was important to you in terms of where the trust needed to go. We facilitated the strategic planning session with you on July 17th. Feels like a while ago, but really only a few months. We had a presentation of the life cycle of a nonprofit. We started with that. And we had someone here from the CNE, is it? That gave that presentation to us. We looked at your mission, vision, and guiding principles. And we spent a lot of time on the guiding principles because that really was your map as to how the trust should be operating and should be doing business. We had discussion on the current state. We had a robust discussion on that. We talked about results-based measurements. We talked about, I think you asked the question, are we relevant? Are we sustainable? And how well we're doing on those results-based measurements. We conducted a SWOT analysis. We had started that for you based on the interviews that we did with you, and you added to that. We did a visioning exercise.
We prioritized and ranked your current areas of focus, and you may remember that. We did some voting with some dots, and we talked about, then carried that forward for the top 3 focus areas in each of the goal areas. And you did some work as it related to what we could do, what you as a board could do, and what the staff could do, opportunities that were there to help us reach our goals. We then talked about some considerations, future considerations that you would like for us to take into consideration as we move this strategic plan forward. As we worked on it, what are some other areas that you really wanted to see rise to the top? And then we did an exercise on timeline and activities in a 6-month category, a 12-month category, and 24-month. So there's a lot of opportunity out there that we have documented that we can be working on. And then we engaged in a brief discussion on funding, and you as a board said we needed to come back and make some recommendations to you on the funding. I think the chairman stepped up and told us what he'd like to see in terms of percentages in each of the categories, but a number of you wanted some additional information. So that's what we're saying we would need from you today to get some direction on that. So out of the July workshop, several things rose to the surface. We created an additional 4th goal, which was about capacity building, support the success of our providers, community. We looked at, you asked us to incorporate in the programs with our providers a life cycle position, to look at them by their life cycle, to designate where they fit in terms of the life cycle, and to create the funding based on that life cycle. You ask us to maximize the use of our resource centers. We had out-of-school activities in 2 different goals, in the 2nd goal and the 3rd goal. You said, let's look at that and realign that, because we had out-of-school activities that were educational based, and then we had summer camps that weren't necessarily all educational based, but some of those could have been, have a safety component. So I think we have done that, as you will see a little later. You said we needed to really focus on securing a CFO, and I think you have all know her now. So we do have a new CEO, revamped funding request receipt process, and I understand that you have come up with a policy on that. Is that correct? As a board, you have come up with a policy as to how the process will work in terms of funding requests. And I remember specifically you said, we don't want it to come directly to us anymore. All of the funding requests needs to go through staff. Increased focus on program indicator and related performance impact measurement. There was a lot of discussion around impact measurements. And you told us that we really needed to have measurements that showed an impact, so that whenever you come up for, in the 5 years and what do you call it, Marcia? Reaffirmation, that we could show the difference that the CTAC was making. And then in terms of future consideration, literacy rose to the top. You thought that was big. You wanted to see more goals related to reading and academic performance. You wanted meta programming infused and incorporated in some of the RFPs with our providers. You wanted to address childhood trauma, and a lot of that through the meta programs. You wanted to grow partnerships. You talked about determining how on your life cycle stage, if you were in a growth position or a startup position, maybe we partner you with some of the mature organizations so that we can grow those partnerships, as well as the CTAC growing partnerships within the community as we do our work. And then support children with special needs. That was a new one. You had not measured anything related to children with special needs before, and I think as we go through this, you'll see how we have incorporated some goals, some focus areas related to special needs into the process. So as we said before, we will come back with goals on future funding recommendations. And we will establish funding based on the cycle stage of the provider. Staff has designated all of the providers into a life cycle stage, not based on a selfie that the providers have done yet, but based on kind of a best guess, based on the knowledge that they have in working with those providers. So they have done that. They have designated each provider into one of the 4 life cycle stages. So that was a good start. So, as Ms. Connor said, we have worked with staff. After our board meeting, after the retreat with you, Couture and I went through all the notes in the minutes and tried to get those in some type of order so that we all could follow and understand. We have reviewed with staff your direction. We have designated, as I said before, providers into a tentative life cycle stage. We reviewed the goals that you currently had in your current plan, those goals that relate to results-based goals, results-based measurements. We had 2 work sessions, in-person work sessions with staff and 1 virtual. The first work session in person, we were here in this room. We went through the focus areas in goals 1 through 3 and really dove deep into those. We brought in some best practices, looked at some of those and give us a starting place so that we could kind of tailor those and customize those to the trust and make them our own. Some of them managed to survive, some of them were totally changed based on how you do business, how the trust does business, and what the trust can measure, what they knew that they could measure in terms of impact. And then that second in-face meeting, we really focused in on goal 4, which was totally new goal. We hadn't done that before in terms of the capacity building. So we basically had to start from scratch on that one. And there's still a little work to be done on that one, but you will see where we are. Okay? Right. So we want to dive right. Any questions so far, any comments before we dive into the recommendations?
I just have one.
Okay.
And maybe I'm getting ahead of myself. So we have in our first strategic plan kind of identified percentages of funding by our 3 goals. And in the last slide, you said establish funding for providers per stage of life cycle, which is a shift, which is great. My question is, how much time has our staff spent on that life cycle? And we kind of in the very beginning of this, because I know the providers haven't given any feedback about that.
Correct.
Yeah.
Correct.
Kind of what's the theory behind that movement?
Okay. Marcia, do you want to
Yeah,
step in on
like,
that?
is that okay? So aside from really acknowledging that it's work to be done, we haven't spent a lot of time on it. We spent all our time on this, which is why my recommendation is, or my ask is that you all allow us until the January meeting to bring you back, really have the funding discussion, because we just aren't ready yet. No, I didn't know you weren't gonna be here. Maybe I forgot. You probably told me. So the providers, if you all will remember, in order for us to do the selfie with them and all of that, that's gonna take time. And the time question, let's say we do it in the next 3 months. And then what happens, right? All of this was supposed to take place in next fiscal year. So our discussion internally was, do we go ahead, kickstart our providers with this process of the life cycle, getting them teed up, if you will, to what all is going to take place, what they should be thinking about, all of that, and then have them sit for 4 or 5 months without any activity, right? because we're not going to be funding them to do anything with the life cycle in this budget year. That all would be taking place come next fiscal year.
Yeah, I guess my input this early in today.
That's okay.
is that-
We're going to have this discussion, so
Yeah,
when
no,
doesn't really
is
matter.
that I'm really interested in getting a base level of where the providers, our staff, and this board feels like each of the providers are before we start to say, based on where you are, you may or may not get funded a certain level.
Right.
And I also think it's important that, I don't even know if we're gonna go that route. Because I've seen how we're supposed to fund X amount for after school and X amount for early childhood, how people start positioning themselves, and I'm only interested in outcomes for our kids. Before we get to that, now let's decide how we fund based on how they're evaluated. And I think having that baseline of where they are is critically important before we enter in the
Budget.
funding piece. Cause, well, I think I'm a growth because they're funded more versus a mature because they're not funded as much, or vice versa.
And I didn't think we were going to be funding them by life cycle.
Yeah, can I,
Sure.
yeah, so probably as the only person who actually uses this is.
Yeah, this is what I want to talk about.
It is not intended to be a vehicle for saying you only qualify for X amount of money. Understand that the life cycle model is designed to help organizations review their own capacity in key areas of functioning as an organization, and to help them identify those areas, whether it's their programming, their governance, their management, their administrative systems, or their funding, to help them be more effective and have better impact, right? So if you,
Sustainability.
and the sustainability. So if you start from the premise that the challenge for any nonprofit is to be relevant, in other words, you're addressing something that is important to the people you are serving, that you have an impact, that you're, in other words, you're meeting that relevant need in a way that actually has the impact you want to have, and that you're doing it in a sustainable way. So those are the three pillars. And then in order to do that, the premise is that you need good programming, yes, good governance, good management, good business model, and good administrative systems in place. And so the idea is not to say, oh, if you're growth, you only qualify for 50,000. It's, you're in growth. What are you doing to move forward? And how much is your system able to take on? And what can we reasonably expect you to provide us with in terms of impact data, in terms of those kinds of measures? So
So isn't it, what is their capacity?
it's what their capacity is. So I would see us setting aside money to help them build capacity, but also not to make the demands so onerous that there's no way that they can meet them at that stage. Some of these folks may be pilot programs, so I don't see how much percentage-wise we allocate to a funding area as related directly at all to this. This may be that we have a pilot program, somebody who's wanting to try something pretty innovative, and we know that we're not going to be able to demand of them something that we demand of an after-school program that's been in operation successfully for 20 years. That's, and I just really want to be careful that we don't use this as a tool to punish or reward, but rather to help improve.
I also think it would be helpful if we had the training, right? So part of what we wanted to do is to go ahead and have you all have the life cycle training. We do the selfie on the trust, and then we have a better understanding, right, of the process of all of it as we start talking about this fully. So, so part of what will happen between now and the January meeting, I would like anyway, is for you all, us, the trust, to go through the selfie process with the life cycle workshop.
That hopefully will come up later in the day. I was just, and I agree, I was just caught off by the third bullet that says, establish funding for providers per stage of life cycle.
Right,
That was-
and that was discussed in the original meeting. We went back and forth, and there were a lot of opinions and a lot of discussion on that. So I'm glad to hear it being clarified today.
Okay,
Yeah, not that we were, it was just, that was part of our discussion. So we wanted to highlight all of the discussion pieces. And then when we have the funding discussion, we walk through what that's going to look like.
and are you prepared for us to have this discussion about the reliance of organizations on the percentage of their budget that's related to trust funding?
We do have at the end some time to talk a little bit more about funding. Yes.
Okay, that's
Okay.
great. Talking about that for a couple of years, and I am interested, and I don't know if I've said this to this board yet, but it came up at a county commission meeting as it relates to CRA funding. And I'll just say what happened there. The county and the city have over 10 years, $70 million of joint funding for CRA. And at the beginning of that 10-year interlocal, Commissioner Pincus board, one of the primary objectives of that funding was not what's the best projects we can use the 70 million for. That was important, but that wasn't the primary purpose. The primary purpose was how can we take $70 million of public taxpayer funding and put it into an area that then generates 300 or 400 million dollars of private funding to really change the community. And I think our trust started out with, let's get funding into organizations that just need funding. But I think we need to, as a trust, evolve into, we get 12 million of ad valorem. How can the trust and its providers turn that into 50, 60, 70 million a year of resources into our community? And I don't know if we've ever had that discussion, but I hope that's where we.
Thank you, Chair Cornell. So I kind of initially, when we started the trust, that was my understanding. It was kind of like we were voting for this initiative to support, provide funding to support organizations in our community. And it was a plus that we could have this local money, then it'd be used to get either outside philanthropic donations or federal matches, right? But I don't know if you guys recall about 2 or 3 meetings ago where I mentioned, and we were getting into all of this tumult in the federal government and with the current landscape that we have. And I also said what I see us pivoting to, and as well as with the state is defunding and not providing dollars in areas to do state functions. And they're shifting that to us locally here. I mean, and we're fortunate that the citizens of Alachua County have agreed to tax themselves more to provide this type of money. And I've also over the years pushed back on us because it seems that UF, who sucks up an incredible amount of resources in our community, wants to come and suck up the resources of the trust. And we have to be careful to not depend on this life cycle model to only fund UF and big organizations like Partnership for Strong Families who's bidding and they're making money. The state agreed to privatize Department of Children and Family Services, and it's my understanding Partnership for Strong Family has that contract, and then they're coming to the trust to get money to run resource centers. So it's like but there again, that's my point, is the state is shifting that to us here. So, and providing impact. I mean, this is really just getting ready to like won't of these larger organizations are gonna want to gobble up all the money, and we will risk not having this tax renewed because people are gonna be like, okay, this is something that the state government and the federal government should be doing, but we're taxing ourselves. And then our little organizations that are closer to the people can't even get funding. We're providing a real good living for those people in the middle. I'm gonna keep saying this. People profit off of the poor people and people in need. And we're providing funding for these organizations for them to do that. So I'm gonna be quiet now because I don't want us to.
But I mean, you raise a good point about the statute says the trust money was not to supplant existing services. But as services go away, then it's gonna be the trustee's decision of what, we're not supplanting it anymore. Now we're providing it. So Dr. LeBron.
I think the other thing that to me is, I get that we do want organizations to not be fully dependent on us. And yet, we voted for this tax as citizens of this county because we knew that there was a significant lack of services for children. And so when money became available, organizations, people who had an idea, created organizations, or really became very dependent on that money. I mean, again, if there had been a lot of money out there for these things, A, we wouldn't exist, and B, we could say, oh, we can only be 20% of your budget or 30% of your budget. But the reality is that there are organizations that exist because the tax exists. And it's going to be very difficult for them in this environment to diversify funding. And I'll tell you, it's not even easy for organizations. Meridian's been around, just to use an example, since 1971. And tried as I might for 20 years, I could never get past 40% of my funding being state and 40% of my funding being federal Medicaid. So diversification is an excellent goal, but we got to understand whether the diversification is possible in a particular niche.
Yeah, I think this board is smart enough to do what you and Tina are saying together, which is we may have an expectation as a new entity growth where maybe we can provide 50% of your budget, but sure, and your UF Health organization, maybe that percentage comes down to something smaller, like 5 or 10%. And so, as we get into this, you'll hear from us, but I think we will get to the right place.
And I think that's what the board was saying in the last meeting in terms of the funding through the life cycle stage.
Got it.
is
Okay, well, that makes sense.
Yes.
Okay, that's the piece.
Yeah.
Okay, thank you.
Fundraising is a capacity.
Of course. Of course.
have.
Many don't. Okay, sorry to derail us.
No, it's good. Good discussion. So now we're going to walk through each of the focus areas and the indicators and impact measurements under each of the goals. And feel free to ask questions as we go or hold them to the end, whichever you prefer. So you have 4 goals now. Well, we started back in July with 3. You have your health goal. Children and youth are healthy and have nurturing caregivers and relationship. Your educational goal. Children and youth can learn what they need to be successful. Your safety goal. Children and youth live in a safe community. And now your provider capacity building goal. Support the success of our provider community. Goal 1, maternal child health programs is the focus area first. And actually, when you rank them, this one got the most votes. We have 2 indicators there. Babies meet appropriate milestones as they grow. And forgive me for reading to you, but I think it's important to kind of hear it out loud. And your impact there is by 2030. And let me say this on that. One of the things we discuss, and you will see a lot of the 2030s timeframes here. And we had some discussion about kind of lining the trust up with the county budgets and fiscal years. So that's why you will see the 2030 versus a 2029. 3 years, so it's a little bit more. That's our reaffirmation. That's your reaffirmation. Okay, so that's why we did it. The reaffirmation comes in 2030. Okay. 85% of babies whose families participate in CTAC-funded programs will attend well baby visits as recommended within the first year of life. We heard you loud and clear when you said we really needed to focus on programs that we provide dollars to. So we have narrowed that to CTAC-funded programs. And then the indicator, that's the impact measurement for that one. Then we have a second indicator, caregivers seeking services will participate in emotional and mental health support services, parental education courses, and community-based support systems. The impact there, we have a SMART goal again. At least 85% of birthing women will receive postpartum care in the first 60 days of the fourth trimester, and 80% of caregivers seeking services will participate in one or more mental health support services, parental educational courses, or community-based resources. No, please do.
The, as far as the indicators are concerned, something that's gonna be of paramount importance to me will be that y'all tell us how you're gonna go about it. So when you put an impact, it would be nice to know how we're gonna do it, before we, before we figure out how we're gonna do, funding, yeah, the funding that's gonna be put forth. And the other thing on the second indicator, it says at least 85% of birthing women that, now is that in the entire county, or is that going to be with our programs? Because it
Our programs.
indicate that in the first impact, but it's not in the second. It says, yeah. Oh, okay. All right. Okay. Thank you.
Dr. Hart?
I just have a question.
But wait a minute, Chrissy, I want, so are you, so when we see this, or when y'all see this in January, we all put something, some teeth in that, so we'll know how you anticipate?
So.
Measuring it, how we anticipate measuring it, is that your question?
Yes.
So our approach to this was, these are not necessarily programs that we are funding right this moment, but based on this, these are the type of programs that we will look to fund, starting the new fiscal year. Am I right about that? And so what we normally do, and I hear what you're saying, and we can come back to the team, but if this is where we're trying to get to, when we create a RFP, the information you're asking for would be in the RFP. It would be how we would reach these outcomes, what type of services we're funding, what we're looking for. And so at this stage, there may not be a program that's created to do this, but this is what you want the trust to, these are the outcomes, the type of programs you're looking for the trust to fund. So we'll take that and then create RFPs and look for services to address those outcomes.
And
I
those
understand what you're saying.
matrices will be listed in the RFPs. Is that correct, Kristen?
That is correct.
I understand what you're saying. My concern is that as you go forward, you're creating an impact, and we haven't really created the how you're gonna go about doing it. I mean, there may be some, you're gonna have to work with any of the people who provide this service, and is that going to be possible? Will they give us the information that we need? That's my concern.
They will have to. So when we create an RFP, those are the requirements of the RFP. Providers should not apply for the funding if they cannot do it. And when we make decisions and have our review teams to decide who's going to be funded, it is based on what's in your RFP. It is based on the interviews that we require. It is based on the rubric that we create to identify the provider who will meet the goals that we're looking for. And then after you are funded, we have mid-year reviews. Are you doing what you said you were going to do? If not, the consequences of that is we terminate a contract. We start again. We come back to the board and say, it didn't work, or they were unable to do it, or it is working, and this is what we're expecting to see year by year.
The evaluation, I'm sorry, go ahead, Marcia.
I would just add, and if you all think about what we've been doing, before any RFP goes out, we come to you, we bring you what all of those specifics are. That would never be in our strategic plan though, right? So the goal, the indicator, the impact, and then we will create everything else. You would then have another workshop before that RFP goes out where we would say, these are the specifics, these are the details, and you would be able to tell us yes, no, take that out, add it. So that process will still take place, but it won't take place in this process, if that makes sense.
Yes,
So I just wanted to
absolutely.
add, that's what we've been doing by adding in each of the workshops before the RFPs.
Dr.
That's
Hart?
good. You usually do not see that much of a detail in the strategic plan, but the evaluation process to those RFPs are going to be critical.
And my concern is that our indicators our indicators and our impacts, we can do, before if we're putting in our strategic plan, I just want to make sure that we can do what we say we want to do.
Absolutely. And staff has taken care in making sure and ensuring that they can get these measurements before we put it into the strategic plan. So we've talked a lot about that, yes.
Dr. Hart?
Hi, I'm just assuming now from what I heard, my question changed a little bit, because I think our citizenry would like to see how much we improved. Like, are we at 84% now? That's not too impressive to get to 85. But if we're at 0 now and we get to 85, that is really impressive.
Okay, so the baseline.
Right. And do we have a way of knowing that, I guess? No, it's 0 now, right?
So the approach to this, and I'm looking at our research evaluation team, at every conversation, the question was, well, what is the measure currently? And so we had that discussion both times, similar to what you just said. If it's already 84, it's not impressive. We're not making a change if we only increase or get better by 1%. And so they are able to look at different data sets, whether that's through charts or whatever the local data sets they're using to identify that. So if your question is, what is it now? I am then going to turn it over to you all to bring some more light to that.
They're just trying to figure out.
And I'm just sort of hoping you'll ask me to participate when you get ready to figure out how to measure these things, because I got a few ideas.
Absolutely.
Okay.
So says the creator of the heat maps.
Well, just to speak on the first one, right now, that's something that it's because the focus is on CTAC funded programs. So right now, it's not something that we're measuring, but when we do start, it has been put into performance measures of programs that we're measuring in the next fiscal year. And so right now it's self-reported on a survey.
The community, do you know what percent of women given birth in the community have? Because that's your baseline.
I mean, I think the bigger question is the goals based on CTAC funded programs. Do we want to be based on babies born?
Oh, it needs to be our programs, like what you're trying to do is show your impact, right? So if you participate in our programs, you go here, if you don't, you're here.
So the way I saw that is like, when I read this, I was thinking of that Healthy Starts book where they've got like indicators for our community, like by county. And we know all those people don't participate in our programs. But when I read this, I was thinking, oh, okay, well, if it's well child visits must be 60% for Alachua County. And if we'd like to see if folks, that's what I was thinking.
Yeah.
That's what I was thinking, that, and VPK, I know the chamber has this little graph of VPK participation by county. That's how I was reading it, based on like I knew we would have some type of baseline, and I saw that little asterisk that it would be, but.
And you'll have the My Charts or the My Sidewalk data that will give you data on a whole bunch of these kinds of issues that you can put. But I think it would be useful for each of these areas to start with a baseline, or we're collecting baseline data, which is perfectly acceptable as well.
And I think since we are narrowing the focus now to CTAC funded programs, in a lot of cases, you will have to use what the county baseline might be versus something that you.
That's what makes sense. We want to say our programs have this
Right.
impact. Right. And, eventually we may want to say we want to increase the participation rate. Well, how do you get increased participation? Show that what you're doing is actually valuable.
Just a point of clarification, Dr. Hart, your involvement, and we do want you to be involved, was it to finalize this measure? Because this is our recommendation, or are you asking for involvement in something else?
When you get ready to put together the RFP,
Oh, absolutely. Gotcha. Okay.
And I think we get to what the chair was earlier. If the baseline in the county is 40%, are touching, let's say, 1,000 women only, but you get your number to show 80%, then you can begin to get others to join money with your money because you have an effective program, and then it can grow. And that's how that comes, is if you can focus on your small population and show that it is the help in the county, not the hurt of the county. And that's more money will come because you do that.
Any further questions on that one? Okay, so the next one, next focus area, programs for children and youth with special needs, brand new, right? Indicator, expanded supports and resources for families and children with special needs. The impact, by 2030, CTAC-funded programs are better equipped and have increased capacity to serve children with special needs. So this is new. We're starting from scratch on this one. So that's why we're saying, and this is a narrow focus as well, that they are better equipped and have increased capacity.
But I mean, again, I think this is a place where we can have a baseline. We can ask our current providers, are you equipped or able to accept children with special needs? If the answer is 10 kids, then we know what we're trying to do is say, well, we want. So I think for all of these, it would really be helpful to have a baseline. Just
Add that, Ms. Robinson?
Another indicator here, identify and fund a minimum of 2 service providers to deliver high-quality programs and support for children with special needs and their families. And the impact, by 2030, more children with special needs receive services. And it goes back to what Director Lombardi was saying. Questions, comments on that one? Baseline, we hear you loud and clear, so we need to designate a baseline for each of these. And I think we have a lot of that information. Still under Goal 1, Family Resource Centers. We heard you when you said maximize Family Resource Centers. Family Resource Centers and Care Coordination and Navigation Services is the focus area. Indicator, families are connected with requested support, and the impact, by 2030, 90% of requested services were successfully delivered.
Since we funded them for a year or two now, do we have any kind of baseline?
The last one under Goal 1, focus area, access to comprehensive health and wellness services. And the indicator, children, youth, and caregivers successfully connect to health, wellness, mental and behavioral health, and social services. Impact, by 2030, 75% of children and youth receiving services experience improved health outcomes. On? Okay. Under Goal 2, we have 3 focus areas. And just want to go back when you did your ranking and your voting at the first workshop, 3 rose to the top: quality care, out of school time activities, and VPK outreach. I've addressed all of those. This focus area, quality care, early care and education, including VPK outreach and messaging. One of the things staff did here was combine the quality care and the VPK outreach into one focus area. Indicator, children and families have access to affordable and high quality early care and education, including VPK. The impact, by 2030, more than 80% of BLI participants, and that stands for Business Leadership Institute, is that correct? Correct, okay. will maintain a class quality rating of 5 or higher. By 2030, 65% of children in Alachua County are participating in VPK programs. Have SMART goals there as well.
Yeah, so again, back on the baseline question, do we know where our BLIs are now? 080?
He's asking the question.
About maybe 0.8.
Where are they? One where I think we could maybe stretch that higher if we. And I'm really more focused on, seems like a lot of the area, I know, Dr. Knopf provided a lot of data for us, but really I'm more interested in how are the high quality childcares doing in the areas where the heat maps are. They're at 4.5, maybe 80% of them, if, you know, most of them are below 5, maybe 80% is a good goal, but maybe it, other areas, maybe we need to push that to 95% because we don't have a lot of deficiencies in certain.
So maybe those are two different things. So you may be talking about the ones that are already at 5, stay there. And the ones that are not yet in that level, how much do we want to increase the percentage of our daycares that are at that level?
Yeah, and
So to kind of,
and I know we're saying based on our,
right.
see, that's where I'm going.
So maybe increase the participation in BLI is, and that may be
In
a
those
separate,
areas.
and
I
that's a
think-
separate impact.
Yeah, I think that's a separate impact, but I think it's critically important
Yeah,
that
I agree.
that for those heat map zip codes, we get more participation in BLI, and then from there, that we get them to 5s.
Focus area, reading and academic performance. We heard you loud and clear. We had a lot of discussion on literacy and academic performance. Indicator here, children are performing academically on grade level. Impact by 2030, 75% of children and youth in CTAC-funded programs with an academic component are reading and have math scores at or above grade level. And here,
So that would be amazing. Oh my God, that would be amazing.
and remember here too, this kind of goes to the out-of-school time activities as well, because remember, you have some out-of-school time activities that may have an educational or academic component to it. So this would fit nicely with those programs as well.
I had no number.
And I was going to say this also, if you all keep in mind, we've just kicked off this whole literacy initiative. There's a lot that we don't know in this moment, but understanding that we're saying by 2030, if we do this right, by 2030, the number should be higher, but we went with 75%, just trying to be reasonable, right? Well, but still, if we are, you know, we should be able to see a difference even in 4 years.
You're absolutely.
Big, go big.
I'm sure.
And we can all. I came in.
For some reason, we see that, you know, we need to come back and amend our strategic plan to look at it more realistically. We can do that.
I wouldn't say, I think the Lee's point is well taken. If you've got kids that are now in middle school, the chances in 3 years of getting them to read at grade level are very different than a preschooler and getting them at grade level. So I think that would be my only caveat, is that you may want to think about some segmentation for age.
your programs.
Right, but they're still coming in where they're coming in, and if they're already middle schoolers, if you're an eighth grader coming into one of our programs in 4 years, and you're not reading at a third grade level, in 4 years, we're gonna get you to reading at eighth grade? Yeah.
So, I don't want to lower that. I was going to ask for some segmentation of it for our early learners, elementary age, as well as the students who are older, as well as by demographic, because we know that Black children in our county are not doing well, right? But we also know that we are investing a lot of money in a program, our organization as well as the county, who is targeting our older learners with good success. So I don't want us to step back. If we as a community don't think we can do this work, I'm gonna tell y'all again, why put any money towards it?
So right now, we're one in three at third grade.
Only 30% can do it. And so if we start out, if we hear the funders are saying we can't do this here, why spend money on it? Let's go and and you gotta believe that these children can learn.
I gotta believe it.
We gotta believe that. We gotta believe that. We got the educators. I tell this with every school I go in. Don't go in telling these kids they can't learn. Teach them to the level where they should be, and they will rise to that. That is the problem. Like, so George Bush didn't say much that I agree with, but that soft bigotry of low expectations is what we're dealing with. But that is the one thing he says, and I keep harping on that. I don't believe, I don't espouse that, but that is what is the hindrance.
Saying it, Tina, keep saying it. Dr. Hart.
And also, don't forget that the voters are going to understand improvement. They may not really care that we didn't get to 75 as long as they can see that we made an impact. The impact is the thing. Doing it. We're going to do it.
So maybe the suggestion per what Dr. Hart said is maybe it's not 75% of children are on grade level, but 75% of children and youth have done their program.
That would be,
Yeah.
I mean, it would be.
So I want 90, so I'm gonna tell you, I want 95%, no, I want 95% of our third grade, by children, by the time they reach third grade, to be on grade level. And then those who are beyond third grade, I want them to have shown at least, no, several grade levels. We don't say improvement, because one score, like the school grade, the Florida school grade, you can show 1 point improvement. And that's what people strive for. And you get this huge bump in your school grade for 1 freaking point. No, it needs to be a high number.
Average them.
No, why don't you segment it? Third grade, say by third grade, we're gonna have 95% of our students reading on grade level. And then for those older learners, we can say, we can get a number, we'll pull it out from the DOE website for where they are on average. And then we come up with something, a percentage from there, but don't say some improvement. No, we need to have like a hard number. We gotta have a target that you're gonna, these Second Amendment people, they wanna kill people and they wanna walk away scot-free with it. Right? So we want to have a solid number that's in the target where we can really aim at something big and go to the voters and say, hey, look, this is what we did. We had 30% of African-American students graduating, reaching grade 12 and get a diploma, and they were not reading on grade level. But hey, in 4 years, this is what we did. We went from 30% to 50 or 60%. Wouldn't it be something that peak literacy is really having an impact? And they're impacting 7,500 students to get them where they're at least reading on 10th grade reading level. I mean, I'm just telling
Everybody
you.
agree? Yeah, you hear it. We agree. Segment that, third grade, and then figure out the baseline of where we are and figure out another goal for that.
Absolutely.
8, 7, 8, depends on the. But Lee,
Other
right
me-
now.
And what's the other measure? What grade is the next measure?
10th grade.
10th grade.
10th. They you have to pass the ELA at 10th grade, get a diploma, or there's some other alternative measure, but 10th grade is that other point where that can prevent them from graduating.
Grade in 10th grade.
No, just third grade as a retention grade and then 10th grade.
Okay,
Have that, Ms. Jackie?
yes, we have.
Okay.
Thank you.
I would just say that in. Zero to five, you know. You set the dates. That.
Well, we could say by 2030 and by 2035.
Like 75% at 20.
25 by
95% by
2035.
2035.
Microphone.
The unfortunate thing is, you know, is where we're gonna have the impact is when the child, when we are there for them from 0 to 18. And right now, you know, there's a number, what, it's been 5 years, 6 years. Now, you know, there are a number of children that never had the Children's Trust necessarily to help. So, you know, being realistic is what we want to do, show that we've improved, that we've made a difference. And as the years go on, you know, if the public goes ahead and reinstitutes the tax, you know, we can continue to show, here's what we've done. And hopefully what we can do is at some point say 95% of all of our children, because we've had them from before they were born to when they were 18. So if somehow we can get all that into, you know, be realistic in our achievement. And I don't think that we need to sell our children short. And Tina is absolutely right. As long as we say, you know, which is one of the big things that happened way back when, is we said that we changed the standards and made them, you know, less stringent. And as a result, I think, you know, all the children rose to that level. If we make it hard, you know, make it, and we raise the level, I think the children will aspire to get there. And we sell our children short when we don't do that. So. Thank you.
Do y'all realize that at 12 years, when we go up for renewal in 2030, we would have funded a group of students for their whole educational career?
On through 8th grade, right?
No, because there will have been first.
There would have been first graders who will be.
5 to
graduating.
18.
Yes, they would have. And we have some programs that have had an educational focus and have tried to do that from the beginning.
Well, yes and no, Tina, because the first few years, we exactly have it all
We
together.
didn't have the measures, but we were funding programs that had an academic focus. 2 of them, the Kids Count, Aces in Motion. I know those 2. There's probably some others, but I know those 2. Girls Place also, those 3. Academic, social, emotional health. And I bet if we were able to look at.
Identify some of those kids that were.
So we have had a whole, the academic career for 12 years of a set of students.
Right.
That we've had some impact, some positive impact on. Now, we didn't have this goal here. But I do think in the next couple of years, I think we also have I'm hoping and I'm pushing, I got a little bit more support now in the school district of saying, look, literacy, it really is important. And I think our superintendent now is really trying to pick up the mantle and help really push this forward. To say, look, some of these things are non-negotiable. Tier 1 instruction is what we need to be doing. But I think when we water down the goals and it gives everybody the pass. I don't know, I'm kind of like trying not to be real cynical, but I think people want money and you're not putting a demand on them, but don't have the bar where you're just so low where it's just like, okay,
Status quo.
you're gonna educate them or incarcerate them. That seems to be the motto. And my uncle has told me that it is people have no incentive to solve a problem when they make money out of it, and incarceration makes a lot of money. And when we don't educate students and prepare them, and that's a deliberate thing, that's a choice people are making. So I just want us to not back off of having goals that are high and changing the mindset of our community to say we need to do this. This is all of our problem. And we need to do this. And we voted to have this tax to do that and to fund these programs. So now let's do the work. Don't give people an out. That's everybody. Even the resource center people. So I'll start there, but
I was with Tina. Keep it going. Okay.
So the third focus area under Goal 2 was after-school programs. And as I said before, you had out-of-school time activities in 2 places originally, and we've kind of broken that up. We're calling this one after-school programs. The indicator here is children and youth have access to available high-quality supplemental education and enrichment services. So an academic component. And by the impact, by 2030, 80% of children and youth attending CTAC-funded programs improve or maintain youth development skills. 80% of children and youth attending CTAC-funded after-school programs exhibit better school attendance than children not enrolled in CTAC-funded programs. So we have a comparison there of programs that we fund versus the general population of children attending school. It could mean a number of things. It could mean STEM programs or arts or sports, even leadership, youth leadership. Maybe Christy or Marsha or Bonnie can speak
Yeah, what
better
we
to
meant
that.
by that is the social emotional skills. So that'd be like self-management, self-regulation, being able to set goals, leadership, communication, things like that. So a lot of our programs have pre-post assessments to see that youth are gaining in those areas, those social.
Don't some of the after-school programs have an academic component? I know we've had that discussion whether or not to put it in there or not put it in there. And I think what we said was if they want to do it, fine. If they don't, then that's fine too. So if they have an academic component, shouldn't there be another impact?
This one is the academic component of after school. So that's what we're focusing in on, is the academic component of
Okay.
that particular program.
I apologize, but what I just heard was not that from Bonnie. The explanation I heard, it was social, emotional, something, but then not specifically an academic.
But it's already in B, so we didn't put it in after school program.
So in B, we talked about 3rd grade and 10th grade and the after-school piece.
Okay, and okay,
Right.
all right. Well, I would think that it wouldn't hurt to have it in there as well. I mean, if you're gonna have it, it's wherever we can emphasize it, it should be emphasized.
Dr. Hart?
Okay.
Just to comment, the second impact bullet point there is that probably children attending CTEC-funded after-school programs are a biased set already of children who attend school. And I'm real interested in children who do not attend school. And the children who do not attend school are not going to be in our after-school programs. Just saying.
that could
Yeah.
be one point, but there could be
Microphone.
the students attending, like, I know for AIM, if they don't go to school, they can come to AIM. And if there's something they want to do at AIM, if that's something that, field trip or something, they know they got to go to school. So I think the two can kind of help with that, improving school attendance. Kind of it's kind of like you can't go play basketball if you miss school that day for some unexcused reason.
If you have an after-school program, you can require a certain school attendance just to be in that after school, I mean, it's after school.
Can't skip school.
The thought behind this one was, again, listening to the school system talk about attendance and how horrible attendance is for our kids. The assumption is if you are in one of our programs, you are going to have better attendance. And so we believe that at minimum, we're going to have 80% of our kids with fairly good attendance.
And that's in
And
comparison
not
to the general
general
population of
population.
kids that are
Right.
going to school.
Right.
So, but I was gonna tell you 80% is too low.
Okay.
So if you miss 10% or more of the days, you're considered chronically absent. So that number really needs to be in the at least 90% or better. 80% is too low.
Right?
Not that they meet.
So right now, we have some students who are in school 78, 80% of the time, and that's not good. So we want it to be higher than that.
So do we want to word this? That students who are in our programs do better than 90% attendance? That rewords the, yeah. That's a different, that's a different impact statement. Tech programs. Yeah. Or better.
You know what, and I was reading this wrong. I was reading it, 80 was the threshold, was the,
No,
like
it's
the
that
80%
80%
of the students. If we had 100 kids,
Right.
80 of them would be have better, but we do want them to have better attendance than somebody else might read it the way I did. Hopefully not, but I think you can leave it like it is, but I do just want us to know that 80% is not good.
Well, we can asterisk and say better means 90% or higher.
That asterisk can say 90, yes. So
Maybe 80% of the kids in our programs reach 90% or better.
was the level, yeah, I was thinking 80% was the level.
How does that rewording, that 80% of the kids in CTEC programs will reach 90% or better attendance?
Now that's better, yeah, make it clear.
A good goal.
Yeah.
Okay. Question. All right, so now we are moving to maybe. Happen. No, this is great discussion.
Why it took us a long time.
Okay, all right. So in goal area 3, which is safety related, our focus area ensuring youth have positive and safe places for engagement. Indicator, children and youth have access to safe places to engage, play, and build relationships. Impact by 2030, CTAC funds summer camps, there's the summer camps, in high needed zip codes. 90% of parents of children in all CTAC funded summer camps report they felt their children were safe at camp. The second one, 90% of students participating in Teens Work Alachua will avoid involvement with the juvenile justice system. And then 80% of students participating in long-term programming will avoid involvement with the juvenile justice system. Those are the 3 impact measurements. Questions, comments?
What's long-term involvement program?
I'm going to yield to CTAC on that one.
I waited till you took a bite before,
Okay.
I asked a question, so.
Where's the long term?
It's the last bullet.
Air bullet.
I don't remember defining long-term. I don't think we defined it.
I think we were just thinking of something beyond a 1 or 2 touch
Right.
program, yeah, that was more involved.
Yeah.
Yeah.
We'll define it,
Yes,
yes.
can define it.
So my comment is that you're avoiding.
Wait,
Oh, I'm-
Maggie.
I thought that was. your-
Don't we already have 90% for the first one? I mean, if I, the summer camp, it was like 100% or 98%. Shouldn't it be higher, 95? I mean, if I read this, you mean 10% of the people didn't feel like their children were safe at camp? You know, I think really it should be 100% feel like their children are safe at camp. I mean, if you're putting them there, you know,
Why would it only be summer camps? Why wouldn't it also be after school and
Yeah,
all programs?
yeah, well,
and if there's some reservation, we can put 98%.
I don't
That
know
would
what that
make-
tells me, though. I don't know what that impact says to me globally in terms of stuff that we want to achieve as a board. I don't,
We were also focusing on summer camps being moved to goal 3 from goal 2, which is education. And so that's one reason why we were focusing on that for safety.
I don't dislike the impact. I just think that it should be a bullet for some. With the impact being that CTEC funds programs in high need zip codes.
I mean, the real safety
I-
measure
I-
though would be like incidents. You know, I'm thinking about safety is, did you have any incident reports of kids that were harmed or, you know? I don't know. To me, it's just not a measure that makes me, by virtue, I mean, what we've said is we have summer camps so kids have a place to go that isn't just wandering the streets on their own. So I don't know what additional information I glean, and an impact is such a high level. Wow.
I mean, I think we also have after school programs so that kids have a place to go.
I see this more as risk management than I do as an impact statement. Let me put it that way. I see this as an operational internal risk management issue, not an external outcome impact statement.
Okay.
I may be the only one who sees it that way, but
Dr. Hart?
I'm just wondering if we aren't leaving out something important from the indicator, because this is safe places to engage, play, and build relationships. What about safe places to live?
we're not doing housing.
Well, we're going to hear about housing later, I hope, right? And so can we put a placeholder here in case we decide we want to come back to it in terms of our strategic plan? It's super important. It's super important.
I just remember in the first flush of staffs taking a look at which goals did all of our programs fall under, a lot of them had a safety component. After school programs, they were summer school programs, they weren't just summer, it just wasn't summer school.
So I think for me, then with the real issue here is, do we have camps, summer programming? Because I don't think they're all camps. Teens Work is not a camp. Do we have programming in the summer that allow in high risk, underserved areas, like outside of Gainesville especially, where kids can have engaging and safe summer activities? I think that's a much more impactful thing than saying that 90% of the kids feel safe. I think how many safe places are we providing? How many safe places are available? To me is a much more important impact than people telling me they feel safe at camp. Because I know some parents will tell you, oh my gosh, you have a jungle gym, that's not safe. And, you know, so, but can I?
Yeah, go ahead and then Tina.
Because I had the two other goals, they're not irrelevant and I think they're important, but they're all avoidance. The value of Teens Work is skill building, soft skill building, employability skills. So, and I know that they measure those things. So I think the impact ought to be around not just avoiding And you could just lump those together, you know, X% of our participants will avoid involvement, define long-term, please, in juvenile justice. And then, but the other is that they gain some skills.
So I was kind of along the, something what Maggie was saying, but I have that gun violence thing in there, and maybe we ask Judge Bullock for something on that safety. She might have a metric, provide some input on it. I know she's not here today, but you know, they had all these, when GPD came and they gave us that information about the number of firearms that they confiscated, or maybe that's some, since that is a gun violence and something that's big, and the trust has been kind of coordinating with the city and funding that, and the county about funding something. And so maybe that's something we do, something along.
And we did have some discussion around that. We didn't use the words gun violence, but when we talked about the juvenile justice system, that's where we were going.
Maybe some type of diversion. Judge Bullock may have something that she can give us.
Like you're talking about the avoidance and then as one indicator, and then gaining skills as another indicator, as opposed to combining them.
Yeah. Find the two avoid involvement. Regardless of your program. What are you gaining as a result of participating?
So am I hearing that we are going to go back to where we were and put skill building and
Yeah,
safety?
so I was gonna say, Amy, you and Bonnie speak up on this because you had a whole discussion with us about why this needed to be separated out. So can you pick up your microphone and kind of explain the thought process behind why we broke it out? Like they can't see right now, focus area, the third, well, it's on your sheet.
I see what you're saying. So you thought the skill building stuff, but, okay, but this specifically like references TeenWorks, which we don't reference specifically anywhere else. So you just want this piece to focus specifically on the safety component?
Correct.
Then for me, the biggest thing is creating and making sure there are safe places
Safe places.
during the
Yeah.
summer.
Okay.
And avoiding juvenile justice involvement is,
Right.
yeah, I got a whole, I'm only on A. I haven't gotten to my thoughts about B and C yet.
So, okay.
I get
three now. Dr. Hart?
I'm just sort of wondering, what happened to all this stuff that we said during the strategic planning session about safe community? Because I'm not seeing any of my contribution here. And I know maybe someone lost the notes and I could struggle to remember exactly what I said, but I was really a proponent of safety being a meta-programming object that we wouldn't necessarily expect. Oh, so it's not in strategic planning?
It is.
Oh, okay.
I think what we attempted to do was just look at safety as a whole, and you see A, B, and C, we broke it down to not just program access, but then also what they gain when they're there. So you see A, it's ensuring that you have a positive and safe places for engagement, and then B, the part of safety where while they're there, they are strengthening relationship with caring adults. So if you have a caring adult, you should have a more positive outcome. You should have a safe place to go or someone that you can share with. So that's the approach we took. And also in a part of these safe places that we are giving families access to, they should also be building skills. So that's the way we approached it.
I like the fact that we're saying, I think 90% could be higher, but I like the fact that we're saying if you're in a program, you're gonna avoid the juvenile justice system. Like that.
But again, then
I just want to be more than just summer camps, I guess is.
and I think then the managing conflict fits in that safety piece as well, right? And maybe Judge Bullard
Correct.
would have some specific recommendations to flesh that out a little. But then I think for me, B goes back to that first goal, which is safe and nurturing relationships. And what's missing for me, and as I was looking at this, is it's still looking at mentoring. And we know mentoring has been an amazing challenge because there aren't enough mentor volunteers. And what we don't have anywhere through here is prevention. And there are a number of strong evidence-based prevention programs. I'm thinking Guiding Good Choices, Seeking Safety. There's a number of those that have great outcomes, have been very well vetted over time, and would provide, they do a lot of resiliency training, teaching kids the kinds of skills that you need to be resilient, independent, to be all kinds of things. So I think, and it is part of having that social emotional development component. That's what they all building. And so somehow I think instead of focusing so much on mentoring, is one-on-one, and we know has been basically impossible to achieve in a way that meets the national standards for mentoring, that we focus perhaps narrower, fewer mentoring, and broaden that out to include some prevention programs that are evidence-based and really well established in the literature. There's Guiding Good Choices, and you know, I've been out of the business for a few years now. Seeking Safety, Guiding Good Choices are two that I know Meridian did for a long time when we had prevention grants, which I think if Cheryl couldn't tell me that the Prevention Coalition, no one, she wasn't sure that they're still operating, it tells me that that's all gone. So
with that Guiding Good Choice.
no, they're specific curricula. They're like a whole hour long. I mean, they could be as an adjunct to something in the summer, for example. It could be a meta program. But I mean, but it is a specific curriculum. It does have to be done by somebody who's certified. I mean, there's hoops because it is an evidence-based program, set of programs. I can, if you guys want to know, I can put you in touch with the folks that I know how those programs operate.
Lee?
I see our indicators and impact, but one of the things that we got back from the report was that we had a higher incidence of juvenile justice children than the state average. And are these really going to impact that percentage down? Because, you know, how many of the children that participated in TeenWorks were involved in the juvenile justice system? How many children in our summer camps were involved in the juvenile justice system? So, you know, these are good, and they should, you know, the impacts are good, but are we really affecting, having an effect on the issue at hand? And I don't know that this really does that. I don't know that we're gonna have an impact on, I mean, the objective should be we want to lower the number of children involved in the juvenile justice system. And what we're saying is if you don't go to summer camp, then you're gonna go run the streets and mug people or whatever. And I don't know that that's necessarily what happens. So
Risk is higher.
okay, the risk is higher, but you know, and maybe.
Or you want to evaluate outside of our programming, just like.
How, you know, how do we actually make a difference in the juvenile justice system? And you know, the gun violence thing would probably have an impact as far as that's concerned, I would imagine. Potentially a significant impact, and maybe that's where we put our eggs in that basket. I don't know, but based upon this, I really don't see that we're gonna have an impact on the juvenile justice system numbers.
Students who are participating in TeenWorks, they're not the folks that are in front of Judge Bullock. They're those. Oh, okay. I heard him to say that TeenWorks wasn't impacting that. So.
No, he's saying we know that that's.
Oh, that works,
He's
yes.
talking about other folks, the kids that aren't involved in any of our programming.
Right.
So maybe some of the research that we can do as an organization is what kind of out of school time programs have the largest impact on juvenile justice avoidance?
I think with the older students, that the conundrum that we're in is we know that TeenWorks is effective, and especially in this common economy that we're having, we've heard since COVID, the school district, teenage students not attending school to earn money for their families, help support their families. So we put almost $1 million just in TeenWorks, 300 kids, right? So we got to figure out some kind of way to have a bigger pool. We Chair Cornell actually put out to the Goodwill guy a way of us expanding and the reach with our money and where, and he didn't, I don't know if he came back with anything. I'm not aware of that. Or, you know, and the folks, so we know that that works.
We did get some.
But our teens, like having a safe space, safe places for students that are not old enough to work, we know that that works. Constructive things for kids to do, and those students that feel that they're too old to be at summer camp, right? The work part and developing soft skills and employability skills is A plus. I stand behind that. Those that are, and then there's some who do athletics and some finances are keep them from doing that, you know, that they want to compete at a high level, but some kids, they think they're going to play professionally and they're mostly not, right? We know they're not, but if they out there running around in that sauna in a gym, run up and down the court like my son did, or a basketball court, it keeps them occupied. I mean, it does. It's just, and those aren't the kids for the most part that we see in front of the juvenile justice judge.
I think we want to know what.
So
Go ahead.
we've had a lot of discussion on this, so I want to make sure that we capture the main points of what was discussed here. So what I'm hearing, and then you fill in where we need to, we maybe look at combining the last two bullets, I'm on A, combining the last two bullets into a measurable impact goal. Are we saying no to the first bullet about families, children, parents saying that their children are safe? We're doing a placeholder for housing so that we may revisit that after the board meeting today. We are going to look at prevention programs under B versus evidence prevention program, like a meta programming, and maybe actually say meta in the goal. And is that right? No? Okay.
But we are adding skill building and employability.
No, not the goal. I'm sorry, focus area. I'm sorry, focus area. Maybe meta in the focus area. I'm asking, is that what, I thought that's what I heard. And then, haven't discussed the skill building one yet, C. Is that what I'm hearing or no? I'm off base there? Yeah, okay.
Just to reiterate, because I seem to keep repeating this, but obviously I'm not making myself understood. So the point of meta programming is that we do not expect the people that we have a contract with to have the staff that can do the programming. So we have an overall programmer, someone who applies for different money that we give, and we expect our contractees to allow them to come into their space and time and provide the programming. And that way, we can address Maggie's concern that the people that do it need to be highly trained, highly skilled to do it. And that just removes some pressure from our contractees for summer camp.
That now. Some of that
Okay.
now, not necessarily all of it, but we are currently, providing meta programming right now
And
to
the-
our providers.
And the beauty of it is that we can do some of these niche things that we think are really, really important, but our community may not have the capacity to provide right at the moment.
I think the indicator B is right in line with what you just said.
Right, but it doesn't belong here if we're gonna consider it meta programming. And that's where do we put it? If this is safety, I think with this, from my, at the way I'm thinking about it, with only a focus on safety, I would say that A is the combined 90%, 80% juvenile justice avoidance, and the ability for there to be programs in high impact areas outside the city limits, you know, kind of spreading around so that there are enough places for kids to go in other than the streets and wandering around. That to me would be kind of the focus of A. And then I don't know what you do with the other two, because it seems to me, well, the other area would be the violence prevention stuff is definitely a focus B in this area. And that should be kind of it in my mind. And then the meta programming, these two things that are here actually in my mind then fall into that meta programming, or definitely goes over there. So one on conflict management or violence prevention, however you want to word it, one on capacity and reduction of juvenile justice. That's kind of it. I think I can't see the strengthened relationships with caring adults as belonging here so much as it does as a meta or in number one, goal one.
I think unless we're
Okay.
talking about kids already involved in DJJ, getting that. Because the one thing we're talking about is preventing them from ever going into
Right.
DJJ, but we've got a lot of kids already in DJJ. A reduction point might be no more continued involvement, because we work with a lot of kids between DCF and DJJ that they just keep getting deeper and deeper because they don't have any positive something.
That's what the judge is gonna bring up.
And so I think if there was a way that we could target, and it would be pretty easy to partner with DJJ, they're doing something between Lutheran Services, CDS, and the Prevention Coalition out in Tri-County to provide like 170 mentoring spots for kids specifically either in child welfare or DJJ to keep them from getting deeper in. By
We
having
need to understand more what's out. Maybe need more information on what's already out there in those spaces too, because I didn't know what they were doing out there with that. I knew.
Christie.
Just a quick question for you all who are involved in that area. Do you think that we will get pushback from other organizations that we're funding or families if we are saying we're going to collect your information, we're partnering with DJJ to determine if you all are already involved because we're measuring continued involvement, or would you all be comfortable with self-report from the family?
On the self-report side.
Yeah, I think they
that's-
might have issues with us contacting DJJ and asking them to release the information to us. But if they were reporting that I have a child who has had their first incidents and maybe they're going to go civil citation and not have a record, but there's an indicator there that says we've got a kid in crisis. And so if we could catch those kids early and somehow get them involved in something positive and change the trajectory that they're headed to, I think that's where we could be impactful.
I think that's helpful as we start to design pre and post surveys to have a clear understanding of the board's interest in whether self-report is okay, because that's normally what we do. It's almost what we prefer, right? Based on the type of
Prefer that.
pushback we have received before. So thank you.
Skills and
And the ability to have a place to
add
go.
places, yeah, places.
Right.
Robinson, you good on that? Jackie?
Okay. All right, so goal 4. And I will say that we have to expand or expound upon some things in this. Oh, I'm sorry. Yes, go back. You want me to go back to goal 3?
So another point of clarification, sorry. As we are talking through safety and we looked at the focus area B, that really was the team working on determining what mentoring looked like. So are we, the board, saying that we should not move forward with mentoring and look into more of the prevention programs?
Before you answer, Maggie, let me tell you, the county commission took the 222,000 that CTEC provided on last Tuesday, awarded 10,000 to ACEs in Motion, and 26,000 to 9 other organizations that are going to be providing councils and places for youth to gather, ICGs on it, I think Kids Council on it, around the community. That's CTEC funding, not necessarily CTEC programming. But it's places, it's development that's in line with what this board has.
My 2 cents.
Yeah, yeah.
If we can't do it right, there are national standards for mentoring that have duration, frequency, duration, length of, so there's all kinds of standards for it. There's actually places where you can get accredited or at least certified as, vetted as having met all those. So I don't want to rule out mentoring. I want to view it as part of a broader prevention concept, which includes best practices for prevention and or mentoring. So if we have a mentoring program that really meets the standards, yes, it's a great preventive tool. But if we don't, and there are prevention curricula that we can apply that have in some respects some of the same kinds of skills that they focused on, then I think that's what we should do. I think it's broaden it out so that we actually can provide something that meets national standards.
Well, and DCF is providing it for those in the system. And 170 kids,
Well,
one-on-one.
it's not DCF, it's Corner Drug Store, CDS, and Lutheran Services are funding a program in collaboration with the Prevention Coalition out in Tri-County.
Which is probably one of the most active prevention coalitions area. And I don't know how they're gonna find 107 mentors in that area, but
Somehow, they said they had capacity for up to 170 kids, but.
then you have more than one mentor, more than one kid per mentor
yeah.
for sure.
In Alachua County? Or-
No, this is
Tri-County.
out in Tri-County, but it may be that we could ask Phil Cabler or somebody at CDS to come and talk about, it's a new program, they've just gotten it started, so I don't know how far along they are.
I mean, it sounds like they're at the same stage as Leah was with UFly 2 years ago. And then, but they're volunteer mentors. That's something to look into, because I agree with Maggie, unless we can do it right, then we're just giving money to folks to try stuff, and I think we're past that. Do you guys agree? Yeah, we have consensus on that. Does that answer your question, Chrissy? Unless we can do mentoring right, we don't want to do it.
That is clear.
But we think we might be able to
That may be a partnership.
look into what Phil's group is doing in Alachua County and figure out what they're doing in Tri-County. You all, the collective all. Good point. Thanks, Lee. Okay, Jackie, let's.
Okay. Number 4, as I was saying, this is an area that I know we are going to have to expound upon some, but let me just talk about the thoughts here, and Christy and Marcia are gonna kind of help with this one. Capacity building is the focus area, of course. Indicator providers will be supported based on their nonprofit life cycle stage, and we've talked about that before and what we meant by that. And then the impact, achievement of individualized result-based performance goals. How much, how well, and are we better off? And then growth in organizational capacity scores via the assessment tools, whether that's a Selfie or some other tool that we come up with. And then enhance the quantity and or quality of programming, services for children and families. And another indicator under this area is providers will be supported based on progress in strategic partnership development. Going back to that, we all take one, we teach one kind of concept. And the impact here, increased revenue, operating budget by securing resources outside of CTAC. And so I'm going to open that up to Marcia and Christy to speak more.
Marcia and Christy, then we got Dr. Lombardo and Dr. Hart.
So this one, we cobbled it down to this particular recommendation because we had taken each
Got a lot, yes.
each level of the Selfie from, if you were a small, the first stage of startup to growth to maturity. And then we had created impacts and indicators for each of those. And we decided that really and truly, it didn't matter where they were in the cycle. These are the things that we wanted to impact. We wanted to find out you know, what their capacity was, what were they doing, how well they were doing it, were the children impacted better off? We want them all to grow. And we had a session with Tracy Berger, a young lady who, like Maggie, is well versed in the life cycle, who talked to us about organizations being given capacity scores and that there were assessment tools that we could use to help us help them determine where they fit, how we could help them increase, again, no matter where they were in the cycle, help them to become more sustainable. You know, is their program a quality program? So is it that we need to increase the quality? Is it that we need to increase the quantity of the children and families that are being served, depending upon where they are? One of the aspects of this is, you know, if you are a mature organization, we would like for a mature organization to help mentor one of our startup organizations. So there's a lot that will go into the capacity building. It doesn't say this on here, Nancy, but this is where the meta programming also falls, because we don't want, similarly to what you said, we're not asking you, the provider, to have to figure out how to get some training. We want to provide the training to you. So we, CTAC, would then provide the overall training to all of the programs, similarly to what we've been doing with our, what is it, the trauma informed care. We literally, they come to us. We provide that. I'm missing. Oh, so there were 1, 2, 3, 4, 5, 6, 7 separate areas that we combined into one. So providers will have access to resource tools to assist with writing competitive grants and applications. Providers will have access to tools and resources that deal with unique circumstances. This is our special needs group. Focus area of strategic partnerships. We want them to be able to build partnerships with one another and others in the community. That whole area of addressing childhood trauma that we know Nancy loves. So we definitely wanted to include, well, you know, I didn't mean it, you know what I mean, like that. And then we talked about the whole community convener and participant in the sessions that may come up where it makes sense for a particular provider to meet and be a part of a discussion. For example, what we did with our early learning folks back in June, we brought them all together to talk about early learning in a community conversation, and we separated them out and they are now having small group meetings, right? So those are the kinds of things that we want to be able to provide under capacity building in this particular goal area.
Maggie and then Dr. Hart.
I have a lot on this one.
Yeah, go, take your time. This is the one we have to develop the most, I think.
Yeah, I have a lot to say on this one. I think that there is a feeling like this life cycle model is more of a measurement than it is.
Okay.
One. And number two, I think to tie yourself to a method, just like we said to Lee, you know, we're going to do RFPs and use best practices and incorporate those into the RFP for a specific issue. We may decide tomorrow we hate this life cycle thing. So to me, the indicator is that we're going to enhance the impact and sustainability of our providers through capacity building, not through this that our goal, the impact we're seeking in capacity building is to enhance the impact and sustainability of our providers. We want them to be able to improve their achievement of the results-based measures. We want them to grow in capacity. There is not really a selfie score. It's you rate yourself as within
startup, growth, maturity, decline, turnaround, or terminal in each of those areas, but it is not a numerical score. It's a self-assessment. It's a sense of where you are early on in growth, later on in growth. And there is a lot of variability. When I do consult workshops on this, scores start, if you will, people say, oh, I'm a 1 out of 5. I'm really early in growth. And somebody else will say, no, I'm really late in it. And it's through the discussion and that you get to a consensus. You can have 2 organizations that overall look like they're in growth, but one of them may be because they are really struggling with governance. Another one may have governance down flat, but has a business model that sucks. So you have, it's not a thing, you know, it's not like taking an IQ test and you go, score. It's not that kind of measurement. So I would say that you want to have a growth in organizational capacity in their self-assessment and in our assessment based on their ability to deliver certain kinds of things. So I would take the score word out of there. So that's, I would reword indicator 1 and the impact. I think that the enhancing the quantity or quality of programming is a separate indicator in my mind. And that's where all of our meta programming should fall. And it's not all what we train you to know how to do. It's also what we provide, what we fund to come into your program and do. So some of it can be, you send your staff to us and we train them in how to identify abuse and how to report it. That's a training. Or we do a specific intervention, one of these prevention models where we have someone who comes into your program for an hour a week or an hour a day for 3 weeks and does this, delivers the service. So I think to me, the enhancing the quality through meta training and service delivery is a separate indicator. With the impact being quality, we enhance the quality and breadth of the impact of some of these meta services. And then that last indicator is strategic partnership development, which is fine. I don't have any problem with that. But I would strongly suggest that we revise that first indicator because I think it's making the nonprofit life cycle stuff into something far more rigid and structured than it actually is.
I like Maggie's comment better than my own comment, and I suggest that we let her rewrite this indicator and impact statement because my notes were little tweaks to it, but hers is a really fundamental, important restructuring of it, and I'm endorsing it.
Yeah, I'm changing what my comment was too, based on Dr. LaVar's comments. So let me ask you a question, Maggie. So is it your thought that there is a time by the end of 26 or end of 27 that each of the providers will have gone through this self-assessment along with us and have at least classified themselves as either startup, growth, mature, or declining or renewal?
Yeah, I think.
And if so, is that an impact that we could put a date into this document by?
Possibly. I think given the scale that we're talking about, so the way this typically runs in an organization is your board and leadership team all complete the selfie. It's online. It's an online tool. You complete the selfie. It creates a data dump that comes back to whoever is helping you through it, right? And then that person leads a discussion where you end up with some consensus around where you really are in each of the legs. That's unwieldy given the timing and the scope. And I don't know.
But could we ask our providers by December 31st of 2027?
The understanding is that what Tracy and Marcia, please correct me, is that what you're thinking is having the director, the executive director of each organization and the trust kind of complete the selfie and then together meet. So it's a shorter process. You don't have 10 board members. It sort of condenses it a little. It will lack some of the
It gets them started.
robustness, but it gets you started. So I think yes, that Marcia and staff could give you by such and such a time, we'll have a sense of where people are. And then the kinds of activities, there is a book that I particularly like that talks about strategic planning based on the kinds of questions you should ask yourself depending on your stage, which I'm happy to share. Tracy has it because I know she and I have talked. There's 3 of us who know how to do this in this right now. So it's Teresa, Tracy, and I. And so we've been kind of talking quite a bit. to help them decide what your next stages are going to be. So I think the next challenge would be for each of the organizations to say, these are the areas I'm going to focus on to move ahead.
So, yeah, so I like that, and I think if we could put a date of when that is, then my comment would be maybe by 2030, CTEC will provide meta services providers for each of the different stages.
Now, I think the meta services are totally separate.
So if a
Meta-
growth
what we
company
provide potentially is consulting on to the providers around
increase
it
their effectiveness.
to increase their effectiveness.
So it's just a real broad
Yeah.
goal.
Yeah, I think that should be part of the capacity building, is just have somebody available to do consulting, whether it's Tracy or, Mary knows a good deal about this too, because she's used it.
Or if they don't even have QuickBooks set up, they can we can refer them to
Right.
these
And that's the
people.
partnership with CNE, and that's part of what CNE can help with, is creating workshops around, if you're in growth, here's kind of how to plan. Let's create a mini plan. And CNE is our partner in that. We can offload that to CNE.
That's part of where we just didn't put
Right.
it all in here, but
Right.
that's exactly.
But so that's what
That's what number 2 is. Providers will be supported based on the
That's
process.
exactly what we discussed.
the meta programming to me is, I'm so totally on board with Nancy on this, right? Is that we can leverage our resources. And that's why I think it's a separate indicator, that we can leverage, improve the quantity and quality of programming by providing meta training and service delivery in areas where the expertise is very specific. And that can include trauma-informed care. It can include prevention activities. It can include any number of things that we have decided are absolutely things that we want to either embed or make sure that our provider staff know how to do or know how to evaluate.
Let's help our folks up there taking notes. Improve the quality and quantity of programming at a meta level.
Through training and service delivery. And then you can decide what percentages of the, you can list what specific programs and what your expectation is for those things to be embedded.
Okay.
That,
As a third indicator, got
and the
that?
third indicator is, the one that's here, the providers will be strategic partnership development. And I do think the convener role is important in that one.
Okay, members, other comments? No, that's great. This is exactly what we needed. Yeah, that's good. Jackie, do you have questions on that, or is that good?
I think we have it.
Okay.
Are we good, staff? Yes, okay. Okay, good. Right. Closing in.
Told you we were the best board in the state. If you don't believe us, just ask us.
Hey, we hadn't talked about funding.
I know.
No.
I made my comment early.
So on this slide, we really talked about establishing funding, and with all the discussion we've had on Stage of Life, we delete that. Delete it from the wording there, and then recommend funding per goal area. We had some discussion on this in the beginning, but wanted to see if there were any further direction, allow staff to ask any questions that they need to ask as they put this together to come back to you with the recommendation. So I'll open it up to the
I
board.
had indicated a funding by goal area, and I don't remember what they were. Can someone remind us?
What, I would like to hear what staff.
We know that, yes, sir, Mr. Chair, you recommended for goal 1 a 35%. For goal 2 was 40%. Goal 3 was 20%, and goal 4 was 5%.
Ignore all that. What is staff thoughts for Commissioner Pinkeson's?
35 for goal 1, 40 for goal 2, 20 for goal 3, and 5 for goal 4.
That was just one member's
Right.
numbers up. Okay, fine.
So staff is torn. Staff hates these percentages.
We have a second.
And here's why. With our current strategic plan, it has been so difficult for us to get to those percentages. It is difficult to get to percentages when you already have contracts out. And those are multiple year contracts, right? So it feels like you're chasing yourself to get to those percentages. This strategic plan will begin October 1st, 2026. We will still have multiple year contracts. We will also have to end some annual contracts potentially, right? If you all think back to 2023, that was frustrating for our providers. It was difficult. It had to be done. But again, we extended our funding by an additional 6 months to allow programs time to wind down, right? So you were already mid-year with a number of contracts when we were talking about trying to hit these percentages. So what am I missing? Any of the rest of the staff who wanna speak up, but percentages are very difficult.
Okay, Lee, you have comments?
That it's imperative that we prioritize on long-term results. You know, that there are certain programs that maintain, there are other ones which probably are very important, you know, but where do we want to prioritize? You know, and I think that was a discussion. Your comments really don't go to that. It just says you hate the percentages, which is understandable. But, you know, I know that in the past I've said that there are certain programs like the after-school programs, the summer programs are, for lack of a better word, maintenance. You know, they help and they're imperative, you know, but there are other ones that will be transformational, like the literacy program, the perhaps the gun violence when we see whatever that ends up being, you know. And as a board, I think collectively that's where we want to provide dollars for maintenance, and we want to provide money for long-term transformational programs. And if there's a percentage, perhaps that's where it should be.
That I feel better about, rather than if we say we're going to put a percentage on a goal, there may be, it may be, what did you say? And the biggest right now would be goal 2, based on what you just said, right? That was the 40%. Right.
Right, I think Ron, well, I'll let you finish your thought, then I'll give you.
Well, the only reason I asked that is I don't think that staff can tell you all what the priority is going to be. Once you tell us what the priority is, then we can come back to you with a recommendation for a particular area. Does that make sense?
Yes. So, yes, and so I look at this discussion as guidelines, not hard and fast rules, as a method, as a way for us to think about impact that the programs are providing towards our goals. And I think we have many programs that provide impact to 2 and 3, 1 and 2, 1 and 3. And I think having the exercise of a guideline for a funding amount for each of those goals is good, but I think sometimes we get hung up with, okay, we have to cut programs because we've got too much in that category. And I think you can look at that category or look at that program crossing categories in a way that we actually don't have too much. Like when, you know, but if we don't have something, then we don't have direction. You know, Nancy's point that she made twice from afar was we need to be spending more money on safety. You need to be spending more money on safety. Well, when staff stepped back and they said,
We're gonna pull that up for you
yeah,
also.
this provides some resources towards safety, teens work. It wasn't classified as safety. And when you redid all that, I was really comfortable with kind of
Where we were.
where we were. And so I just like it as a guideline as opposed to a hard and fast rule.
And I think that's the clarification maybe that staff needed.
Because I think when you're asking a program, show me your impact, they've got to fall in a goal. And if you're spending all of your money in one goal, then staff's going to be like, wait a minute, hold on. Who's the best of providing that impact for that particular thing? That's who we need to fund as opposed to just, because we're always going to have more requests than we're going to have resources to serve.
That,
Nancy and then Maggie.
So I agree with everything you said, except I just want to make sure we understand that new information may come to us that will make us want to fund something that is a twinkle in our eye right now. So I don't want anything so rigid that we can't be a learning board and a learning organization. So we need to know what's evolving around us. And maybe it already evolved and we just didn't know it did.
And I know I missed a number of meetings this summer, but did I hear you say that we now have sort of a checklist? Because what I was envisioning is a list of all of our provider or contracts and our 3 goal areas. And just like, when you go check out, do a little checklist.
We did that. We
Okay,
did that.
so-
that up.
Okay, good. Because that to me is helpful in terms of saying it's really not the percentage. If it's really, are we addressing the need? I also think that we need to, and we've not done it. Sorry, fund balance. How we deal with the fund balance that we don't know we really have because we keep thinking we're spending more than we really are. So for me, I want to make sure that if there is a crisis where we need to do time funding, and I'm thinking like right now, there's this whole food insecurity thing happening in our.
Talk about it before.
Right, so I want to know that if it's a 1-year problem or a 6-month problem, we can dip in and have a plan for how do we use fund balance. Do we have a pilot program that's really not even in startup yet? It's just really in the idea, but we want to provide them the support to test out their theory. I think one of the beauties of a program like this is we can develop practice-based evidence by funding a pilot. So is that a good use of fund balance, right? So I think that's the other piece for me. I don't worry so much about percentages. I think about it a little bit like, when you have a investment committee and you say, well, we'd like 20% in equities, but really it could be anywhere between 15 and 30% in equities because we don't know what that's going to look like. It helps you prioritize, it helps you create some safety margins, but I think rigidity about it is not appropriate and not helpful. But I think if we had a clearer sense of what do we want to fund directly as programmatic, what do we want to fund as innovation, and what do we want to leave for emergency? I do think we need 5% would be about roughly $400,000 to $425,000 right now. For capacity building.
Capacity right now.
Right, so that to me is one that we probably want to set a number, not even a percentage, but a number around, right? But the other stuff to me is more, are we meeting our priority goals and the programs that are meeting those, that's what we fund. And it may look a little different year to year.
Okay.
When
Lee?
does everybody have a shot?
Yes. Wait on, Tina's gonna come in on top of you.
Mr. Chair, I would recommend, I told them before I thought the strategic plan, I wasn't really, looking forward to it that much, but it ended up being a great thing in July. This has been very helpful as well. To such an extent that I'm proposing that we do an exercise. Y'all fall out of your seats. And we take the 4 goals and the indicators, and we put a chart, and we have the different members and staff go up and indicate which ones they think are transformational, and just leave it at that. you know, and then from that, we can see which one the board really prioritizes as they will make a difference. And then we figure out how we want to go from there as far as funding. Now, I will not be here for that one. Unless.
Your impact, your
Yeah.
input.
Yes, because I went through in 5 minutes and kind of went through and determined which one I thought were game changers. But we prioritize this.
Which one was it?
I thought goal number 1A was a game changer.
1A, maternal health, okay.
I thought goal 2, I thought A and B, possibly C, depending upon what the program. And goal 3, B. And I'm not sure about capacity building.
Okay. Carol and then.
I don't have anything else to add. I think I've added a lot.
Do you, well, let me reframe the question. Do you think we should have percentages attached to the goals? That's what staff is really saying. Back to in our strategic plan. Because as we have developed programs, these percentages are causing conflict on should we recommend it or should we not, based on how many dollars are already allocated to those things.
Yeah, I don't, I'm not a huge fan of the percentages. I do like the prioritizations, but, I don't.
Lee's approach is not just.
I don't like, what I don't like is when we put the percentages or we put something on there that seems that the programs are competing with each other. Like, that's what I felt that 0 to 5 and the older students, when we first started, that's what we had, this conundrum. And it pits folks against each other for scarce resources, and I don't like that. We know we don't have enough money to do everything. But I guess we just try to address all the needs. And if there's something that is transformational, I do. But how do we agree upon that? Like you take a child who, I think literacy is really, really important because schooling and skill sets and on poverty wages, minimum wage is life-changing. And that keeps them hopefully able to provide for their families, food and shelter, basic needs. So that keeps children out of juvenile justice. So I think we kind of like,
So what I'm hearing you say is you like what's the highest priority of the goal?
it's always going to be competing. So I don't know how we get rid of that competition. But but I don't think literacy is the children's trust lift. I keep saying the school district, we need to put pressure on the school district because they're the one, that's the space they're supposed to operate in.
I could argue the same thing for safety.
And then safety, for who?
I think literacy.
It is, I think we all can support it. So I don't know. Well, I don't know how to get us there. Cheryl, go, maybe you'll give me
Well,
a.
and I think that where we went into that percentage mode before is because we did that evaluation where we listed all the programs and we're like, okay, where are their impacts? And we saw we were really heavy on certain areas and then very light on others. And we're like, well, we've got to make this more equitable. So if we can come up with a different way to be more equitable, but address the issues as they arise, because again, it's going to be an evolving, our communities are not stagnant in what the need is. And so there are some needs that we're going to have to continually focus on the education component. That's always going to be an issue. But I think flexibility, not to be so stuck on 40%, 30%, 20%, giving staff the flexibility for that. I'm all for that. As long as we're covering everything somehow, make it work, Bobby.
I think having outcome
and performance data that's reliable is going to help.
Okay.
I'm sorry, I think once we have reliable performance data, what we're gonna have is a reduction in the number of providers. Attrition will happen. And then you'll have fewer recurring contracts and we'll have a clearer sense of where the money is going and where it's landing. I still have my, Lee has his, mine is that we budget 13 and it turns out we really only used 9. And until we can get that closer so that our budget reflects our reality a little bit more closely, I think the percentages will ultimately take care of themselves. I think we've got at most, I think 3 in some goal areas only have 2 indicators, some have 3. I don't know how you, with 3 big goal areas, how you're going to cull it down and prioritize it. That's what we've done. We've come up with the priorities, right? So I would have a hard time saying this priority is bigger than that priority because we've already kind of done that exercise to get here. So I think that it will take care of itself as we more and more focus on performance and reduce the number of providers that meet that. There is a finite number of eligible people in the community who can do this work, right? So I think if we focus on improving it, I don't worry about the percentages at that point.
I think you are hearing consensus from this board that we can drop the percentages.
The only one that might, the only one that might fall in that category would be the 4th goal.
Capacity
Capacity
building.
building.
Yeah, but that's the smallest of the money that we've allocated. And so I mean, I think the feedback though that you were asking for is should we have percentages? And if we should, what should they be? And what I'm hearing is not sure if we should even have them and we're not ready to tell you what they should be, so let's drop them. And I think, I think we originally did that because we had a finite amount of money and we wanted to make sure it was fair. But we've now gone through 5 or 6 budget cycles. And so I'm okay with dropping the percentages if that's the board's wishes. That's what I'm hearing the board say, unless, am I incorrect? Well, I like the moonshot stuff that we're talking about. Here's my highest priority, but I think we handle that through the budget. I will tell you that the library doesn't have percentages, the Board of County Commission doesn't have percentages, the City Commission doesn't have percentages, school board doesn't have percentages. We have statutory requirements that we must fulfill. We have needs in our community. And every year we listen to our community and our budget reflects what our community has instructed us every year. And so that's just what it is. So. What's the next step?
Literacy is only, as far as literacy is concerned, that's ongoing and that's never, it should always be a.
550,000 for 3 years, which is more than 5% of the ad valorem tax revenues. That's a big commitment.
Investment, right.
But that's over, that's 5%, but that's as far as the goals that we put in place for, 1, 2 and whatever previously. That's not nearly what was allocated
Oh,
in
no,
some of the
no, no, no.
goals. And so.
This is above and
literacy-
beyond what we've always
so-
done.
So I think literacy, we've allocated, 500 or $550,000, but as far as for a goal, because that is going, if we're going to shift the momentum one way or in a positive direction, then it's probably going to take more resources.
And I would say if we did Lee's exercise, my priorities would be pretty similar. to his.
I'm not so sure, but I think that.
Well, we were just preparing for your activity.
This discussion is leading to an activity. That's what I think is happening, but
I am not going to ask for a cut of your consult fee, okay?
So I just wanted to add that the 550,000, remember, is coming from fund balance.
Yeah, that's a fund balance.
That's a fund balance.
More than 550,000 because there's literacy built into
Way
the
more.
programmatic.
Correct.
Included in that.
I would like to ask for a bio break for us. So if we can do 10 minutes and it is 2:40,
We'll
2:47.
We'll reconvene at 3.
Okay.
All right.
Okay, it's 3 o'clock. We're gonna reconvene this workshop. Again, we've got a hard stop, probably a few minutes before 4 for our board meeting, but with that, I will turn it back over to Robinson. Or Jackie. Okay, Jackie, yeah. Let's get a microphone. There we go.
I think everybody's back in the room. So we've given you a couple of Post-its. And in our discussion, there are some folks that still want to see where you would put your greatest emphasis. So those areas that you really believe, those goals that you really believe are transformational, we'd like you to put a Post-it on there. So you've got 4 colors. Goal 1 is the pink. Goal 2 is the blue. Goal 3 is the orange. And goal 4 is the green. If you would just put a little A, B, or C on your Post-it and place it over there, we didn't have dots, so we're working with Post-its. Just tell us which one of those goals, or multiple goals, that you really believe is transformational. So the staff, when they're doing the funding, can see where you are leaning in on, those areas that you're feeling. Now, you do know that we'll be making the changes on the goals that we've discussed. But you have a list of all the goals, A through D in some areas. And just go up to the goal area and put if it's A, B, or C or D on each one. It doesn't matter, whatever you think is transformational. So this is really so the staff, when they're doing their funding work, knows where to put the emphasis. You may decide that there's a whole goal that is not transformational. Don't weigh in on that.
Everybody,
Ones you believe are transformational.
all right, let's do it.
Don't y'all think y'all should participate as well? You on first.
Yes.
Oh, okay. You need more.
No, so I'm asking so I can go all in on one, and I think that's.
Blame Lee for this.
Oh, look at that. We're starting to see a trend up here.
Numbers like what trends, like, year over year, month over month, quarter over quarter.
You ready, hold it? You're quick.
Let's smile.
I heard about financial.
Before you came on board, one of the things I had. Okay. Yeah. Give it everything. Yeah, make sure we have requirements, and you and I mentioned that we try to be able to get this. Sure, I'm gonna be gone the. Today is actually a good day. Because of Wednesday and it's mostly Wednesday. Yeah, for Wednesday, and it's usually one. Oh, so I have. I was a little bit that happened. Sounds good. Yeah. Yes. Let me help. That's gonna be, I think they're gonna be very short and very present conversation. It's not a pretty picture these days. They love everything we do. The proof and the number of people that need to read it is not.
Being poor and having mental health is a crime.
And gosh, guess what?
It's like against the law now.
It's, I used to always tell people, mental health is, and the economy. Economy is good, mental health improves. Demand goes down. And the economy declines, demand goes up.
Well, that makes sense, because of the additional things about being able to make, financial.
All this additional stress. And when you have a number of people that live one crisis away, one emergency away from losing everything. It's constantly putting band-aids.
No,
Talk about nonsense.
Dr. Hart did that.
I'm really worried.
I think
I tell you, we did.
Medicaid.
We did. I could not get any. And another 45% or so be states and be federal. And a large portion of substance abuse treatment now is either funded directly from the feds or just direct through those DCF folks down to managing entities, or it's Medicaid.
Meaning.
There aren't alternate payers. There was nobody else. And, you know, I used to kid the folks at the Humane Society. It's like, can I borrow one of your doe-eyed puppies to sit with my schizophrenic? Because I can tell you that my schizophrenics apparently are not appealing. Outside of the mind.
We don't have institutions.
Our, the.
You know what?
Severe, right.
Institutions.
Right. They can help.
There's a,
My natural father was. Had his first mental breakdown. That's the only thing where. And then he had VA support and the home and those places when he's going.
see, I don't think you need so much the. I'll say, the folks that we have in transition, Central City, is incredibly well.
Okay, so if you want to know the results of the votes here for each of the goal areas, I'll just read the top one. For goal one, maternal health is the top vote getter in terms of transformational. For goal two, reading and academic performance. And then with 7 votes, and then quality care and education VPK had 5. So those are the top 2. On goal 3, it is violence prevention with 4 votes. And then DJJ and access place to go was tied with 3. Goal 4, it is. Which area? City building. Hear that? On goal 4, capacity building, and then training and delivery, Meta were the top 2. Okay.
Thank you for that exercise.
So thank you. And any other questions or concerns that we are?
So Marcia, does that help?
Okay. So thank you so much for your attention to this. We have our orders, our marching orders. We'll go back and refine and come back. The next step is coming back on January 26th, hopefully with the refined document, the funding information for your approval. And if there are any changes at that point, then Marcia will bring them back in February. So thank you very much.
Okay, thank you. So, members, any other questions? So we will move from adopting the revised strategic plan to then getting right into our budget discussions for approval over the summer. On that, sounds good.
Look forward to seeing you.
Chair, I just want to say that I want to thank them very much for everything that they've done. I actually think this was an incredibly instructive and beneficial time spent. And much as I hate to say it, we'll miss y'all in January.
And
Although the rest of the board won't mind that I'm not here.
no, we will miss you too, and we hope that we can bring this all together. We know that the doctor is going to give us some help with goal area 4 and helping us to rewrite it so that we can incorporate it into the final document. With all the work that the staff has done, this has really helped us to put some, really crossing some Ts and dotting some Is, so we know exactly what you are wanting us to tweak. So we feel good about the final draft that we can bring back to you in January. And again, as Ms. Gibbs has said, if at that time there are additional tweaks, it will be brought back to the board meeting on the 9th, I believe it is, of February for final approval. What Marcia has also asked of us is that once we now have a approved strategic plan, that we can work on doing focus groups with her and the team and communications to make sure that everyone is aware of the changes that are coming and begin to prepare for such. So we thank you so much for the opportunity to work with you on this and look forward to the continued work that we have to do. Thank you.
Ms. Robinson, Ms. Gibbs, and Ms. Dennison. Thank you. Thank you so much, Ms. Robinson. Okay, so I think that's the workshop piece. We'll now open it up. Is there any general public comments? Anyone running to the microphone? Any members? Any member comments before we adjourn prior to our 4 o'clock meeting? Any member? Okay, we're going to stand in recess for 45 minutes and reconvene at 4.